Good afternoon. I'm Senator Gary Daniels from District 11. Today we'll be holding a meeting of the Senate Finance Committee. Before we get started, I'll read through a checklist to ensure that the meeting we are holding is in compliance with the right to know law. As chair of the Senate Finance Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I'm confirming that we are providing public access to the meeting by telephone, with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform. And the public has access to contemporaneously watch and or listen to the meeting on Zoom or YouTube, and via phone by following the directions and links provided on the General Court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remotesenate@leg.state.nh.us or call 603-271-6931. In the event the public is unable to access the meeting, it will be adjourned and rescheduled. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking roll call attendance. When each member states his or her presence, please also state where you are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I'll call roll. Senator Morse.
Senator Chuck Morris, I'm in the Senate chambers.
Senator Hennessy.
Good afternoon, Aaron Hennessy from Littleton in the Senate chambers.
Senator D'Alessandro is excused. Senator Reagan is excused. Senator Gaida.
In the Senate chambers representing District 2.
Senator Rosenwald.
Hello, Cindy Rosenwald, District 13, Nashua, in the Senate chamber.
And I'm Senator Gary Daniels, and I am in the Senate chambers. I would now invite you to join me in the Pledge of Allegiance. Okay, we will start our work session with the New Hampshire Hospital. Good afternoon, Karen.
Good afternoon, Senator. So for this section, it would be Heather Moquin and Joe Caristi would be the two people that would likely be available for questions.
Okay, we will get them in. And I think we have everyone. Okay, so you have two items before you on New Hampshire Hospital. Are there any questions from the committee for the department? I guess I'll start off. In each of these, you seem to be going after a permanent staffing recruiting firm to reduce the vacancies. I normally think of that as a function of human resources. And I wonder if you might address that.
Sure. So this is Joe Caristi, the Chief Financial Officer for New Hampshire Hospital. Can you hear me okay?
Yes. Very
Okay.
good.
So with nursing recruitment, it's a little bit of a specialized service in the healthcare industry. And given the amount of nurses we're looking to recruit for, this is more of a large volume kind of recruitment effort, and also to some degree an out-of-state recruitment effort. So trying to build our psychiatric nursing workforce within the state of New Hampshire, knowing that our in-state pool of psychiatric nurses is somewhat finite at the moment.
Okay, so you seem to just address primarily the psychiatric services. What about the residents, the transitional housing?
So that is a facility. It's a step-down facility from New Hampshire Hospital, but it is for psychiatric patients as well.
Okay. And why the high cost? I mean, if you're out there recruiting, and I'm not sure the process that you would normally go through, but you have 3.8 million on one side and 80,000.
Sure. So we actually have very few nursing vacancies at the PATH program at the moment. That's counting unit 6096. And we think that we can be relatively successful in nursing recruitment in that regard. So that's why the number is smaller there. In accounting unit 8750, the number is much larger to reflect a much larger amount of nursing vacancies. So as of this morning, I believe we have 33 registered nurse vacancies at New Hampshire Hospital.
At 33?
Yep.
And the first one was how many?
I actually believe there's just one nursing vacancy at the Philbrook Center at the moment.
Okay. Do you contract out a set price with the staffing firm, or is it based on the number of people recruited?
It's usually based on the number of people recruited. So the numbers in front of you today were based off of a proposal that was given to us. That proposal, I believe, had $85,000 in upfront cost, and then the remainder is paid out per successful nurse recruitment. So it's per nurse after that. And I think in speaking with a few other organizations who also specialize in this kind of recruitment, they seem to have similar models as well.
Thank you. Senator Hennessy.
Thank you. I have two questions. One, in that model that you speak of, does the nurse, the RN that you hire, have any obligations to stay for any amount of time?
So a portion of the payments that we would make to the vendor would, in most of these arrangements, does trickle down to the nurse in some capacity over the course of 2 years. And so yes, the intent is that if we can get somebody to come here and stay for 2 years, they'll likely stay. That's kind of our hope. And in talking with these companies, that's the construct we would be pursuing.
So they don't have an obligation, they just have an incentive?
Correct.
And does the New Hampshire Hospital qualify for SLRP funds?
I would defer the SLRP fund question to Karen. I don't know much about SLRP. I do also want to say if the placement, so if in these companies, when their placements fail, it's usually no cost to replace the individual. So I did want to just make that comment as well.
I'm not sure if these candidates would potentially qualify for SLRP funds. I can find out.
Further questions? Senator Gaida.
Thank you, Mr. Chairman. I understood that there were 33 vacancies for psychiatric nursing at the hospital. Is that correct?
That is correct.
I'm astounded at $3.8 million to fill 33 vacancies. And if we just took that money and offered them a better stipend or better annual salary, it would be much less expensive than $3.8 million. And so is that something that is in the calculus perhaps? I'm certain that, I'm certain that pay is probably a consideration.
I would certainly agree. I know that our team, and I might ask Heather to jump in here. I know we've been doing a lot of work relative to recruitment and retention, and maybe Heather, you can speak to that a little bit more.
Sure. So we've done a lot of work around this area. Most recently, we've been working to recruit new grads, but we've been impacted by COVID. So, in years past, we were able to go to, on-site recruitment events at nursing schools, and that's really how we filled the majority of our positions. With COVID, there was little to, I think, none of that last year. This year, it's been very limited to some, online recruitment events. But separate from that, working with DOP, we did put together, or we've had an enhancement for pay for our RNs. But despite that, we really have not been able to attract out-of-state new nurses really to the state. So it's a workforce issue that we're struggling with, as is many in the state actually. And in particular, I think we're harder hit because of the psychiatric need. So that's really where we need to call on a company that can, give this focus and utilize this money to put towards incentives. There's a lot of complication also just working within DOP rules and just working through all of that. It's a very slow process, and we really need these positions filled urgently. So that's another reason we wanted to move forward with the recruiter, in particular as we increase occupancy here at the hospital.
The other thing I would just add is there was a recent enhancement for a classification of staff at New Hampshire Hospital, and that the cost for that was $4 million a year. So that was actually an $8 million cost for the biennium for that enhancement. So it is possible that further enhancements would actually cost more than this recruiting cost.
Follow up?
Thank you. Could you explain that again, Karen?
Sure, Joe, can you give the detail on which class of employees that enhancement was for?
Sure. So mental health workers, which are essentially our frontline staff, they're unlicensed staff. We instituted a 20% pay enhancement in December for that group of individuals. And that total comes to about $4 million a year.
Did I understand that those are that those are unlicensed assistants?
Correct.
All right. The number that I get with $1.9 million a year is about $57,500 for each of the 33 employees. I can't imagine that we couldn't compete around the country for nurses with half of that as a stipend per year and cut the costs by half on this and get the people that we need.
We could get you a calculation of what the enhancements would be, because it wouldn't just apply to the vacant positions, it would apply to all the currently filled positions as well. So we could get you a calculation on that.
Follow up?
Follow up?
Are these classified positions?
Yes.
Okay, so why would a recruitment incentive apply to someone that's already employed?
We would not be able to do a recruitment incentive, I don't believe, through the current hiring process. We could only do an enhancement, which would have to apply to the entire class of employees.
Chair will state that Senator Reagan has joined us in the chamber. Chair recognizes Senator Rosenwald.
Thank you. I'd like to follow up on Senator Hennessy's question. We have $5 million unspent in this biennium's appropriation for the state loan repayment program. And why wouldn't we try to use that first and keep those RNs in New Hampshire for 3 years, fulfilling the obligation?
I did just send the question over to public health, so that's something we'll look into and get back to you on.
Thank you.
Thank you. Further questions? Senator Gaida?
I'd just like to confirm that the reason that you cannot apply a recruiting bonus to hire is that the current contract for those classified employees prevents using a recruitment bonus. You'd have to apply to existing employees as well. Is that what I'm hearing?
Let me get back to you on that. I certainly don't want to state it incorrectly.
Thank you. I'd appreciate that.
You're welcome.
Thank you. And just I have just one further question on the breakdown. If we look at the psychiatric services in that 3.8 million, that basically comes out to $115,151 per person. If you only recruited 2 people over the biennium, would that company only get paid 230,000 as opposed to the 3.8 million?
That is correct. There would be a very, I would say, less than $100,000 of upfront costs that the contractor would likely keep, and then after that, it would just be per placement. So yes, it's more of a pay-as-you-go construct with these companies.
Okay, thank you.
Yep.
Any further questions from anyone? Is there anyone that desires to take any action on anything? I think the department has indicated there are a couple things that they're going to get back to us on. So seeing no further questions at this time, we'll thank the department, the division, New Hampshire Hospital people for being with us. And go on to the Division of Medicaid Services. Any questions for the department regarding Medicaid services? Division of Medicaid Services. I did have a question on number 1, which is the adding funding for Part D prescription drug premiums. Do the plans that you give out for the dual eligible population vary from one to the other? Or have you got a set plan that basically everybody gets?
Henry, were you able to hear all of that question?
Yes, it's a set plan, Senator.
Okay, so having worked in this field and that's where I'm employed, I know that some plans can be as low as say $13, $15, while other ones can be as high as $70 or $80 per month. If you're going with one set plan, then that means that the person who may be able to get by on generic drugs is paying the higher price to get the brand name drugs as well. Isn't that not correct?
So, Senator, I think it works a little bit differently here in this space with the dual eligibles. What New Hampshire, the state, is doing is contributing towards its share towards the federal program for these dual eligible people, and so it's that cost share is brought forward in each year. It's a rate that we have to pay in order to pay New Hampshire's share that is based on a historical calculation of drug spending in New Hampshire that goes back quite a few years. And so each state gets its, if you will, defined amount it has to pay. It's not something that we get to negotiate. It's what CMS tells not only New Hampshire, but each state what their responsibility is for covering the Part D expenditures.
So the state doesn't get to choose the plan. That's what I'm hearing.
Correct.
But you do, but those changes can occur 4 times a year, correct?
The rate that we, excuse me, I'm getting some background noise. The rate that we pay is determined basically once a year, typically around October. There has been an enhanced FMAP that's applied during the public health emergency. But there's not, I think you're thinking more of how it would work in the commercial space. This is really kind of a New Hampshire contributing towards whatever the feds are providing these individuals.
No, actually what I'm thinking about is someone on Medicaid can change plans 4 times a year, once per quarter.
In our Medicaid plan, in terms of the Medicaid component, there's an annual and chance to choose, and then typically you have a 30-day period to to change your plan if you've made a selection. And when we implemented the new contract, there was a 90-day option, but that's all we, unless there's a for-cause reason, that's how someone can change what plan they're in.
Thank you. Any questions? Senator Rosenwald.
Thank you. I have a question on item number 1. Is there additional FMAP for dual eligible prescription drugs?
So the rates that are given include the additional FMAP, and they're time sort of sensitive in terms of, if it goes to this period, then it'll be this, and if it doesn't, it goes to the other rate.
I'm sorry, I didn't hear that.
Can you say that again, please?
Sure. There is a federal matching percentage adjustment made in the rate that's published to New Hampshire. And so what the federal government has said is if the federal emergency goes to this point, it'll be this rate. If it stops at this point, it'll go to this higher rate. Were you comfortable with that answer, Senator?
No,
The answer is no.
Okay.
sorry. I didn't understand it because in light of numbers 2 and 3, where you're contemplating changes and additional FMAP, why don't we get that for number 1?
We do get additional FMAP in terms of the prescribed amount that New Hampshire has to pay, that's published by CMS to each state, that for the period in which the public health emergency is in effect federally, that there's a different rate than when it ends. So it's built into our assumptions that are here. I think that why we're making this additional request is because at that point in time that we put together the agency budget, there's the final rates that we would be subject to during this period were not fully known. And so this was to update it to what is now known figures.
Could I follow, please? So why on 2 and 3, you have additional federal funds, but not on 1?
Because it's built into the numbers. I think what.
Henry, can I jump in?
Please.
So on number 1, that is actually billed to us. So unlike other things like in 2 and 3, where we're paying the expenditure and earning the federal fund, number 1 is actually billed to us. And so they reduce what they bill to us, factoring in the enhanced FMAP. So we don't budget additional federal funds here. This is 100% general fund accounting unit. We get billed less from the federal government because of the enhanced FMAP.
Thank you.
Okay. And if I could, so are 2 and 3, because Medicaid's an entitlement program, do we really have, how much of that is optional? If we don't put these in, you're still going to need these federal funds, general funds, because of the caseloads, because of the contract with the MCOs. Where will the department get these appropriations if we don't put them in the budget for Medicaid?
I don't know. I don't know where we will get them from. It depends on what the final budget looks like, but I will have to reduce general fund expenditures somewhere else to transfer these funds.
Thank
So
you.
it'll come from some other program that's not mandatory, presumably. I don't know.
Further questions?
Well, I'd like to move some of these items, but maybe there are other questions.
Is there any item that anyone wishes to address? Seeing none, is there Senator Rosenwald?
Thank you. I would like to move first items 1 through 5. But maybe we could take them up in
I'm sorry, I didn't-
pieces. Maybe we could take, well, I'd move items 1 through 3 first.
Okay. Is that a motion?
Yes,
Okay,
please.
Senator Rosenwald is moving items 1 through 3. Is there a second to that? I'm sorry. what was-
For the sake of discussion, I'll second the motion
Okay,
and
Senate-
retain my right to withdraw that.
Senator Gaida seconds for the purpose of discussion. Senator
So-
Gaida,
If we pass those three provisions, what will the net cost be to the department and the state? From the general fund, yes. I'm adding them up here.
6 million. Right,
25, so 26.
so
One,
about 6 million, right? No,
I think the general fund cost for these three items would be about $15 million. You've got 5.6 million on the first one, -9 on the second, and positive 18.6 on the third.
Senator Rosenwald,
thank you. I mean, they do bring in federal funds in large amounts, but I can't even think what we would not do on the other side. Maybe we can pay for this out of the 21 surplus. But we can't pay for Medicaid out of federal funds beyond what we already get for our match. I don't see how we're not obligated to do this, honestly.
Senator Gaida,
Yeah, were these items presented in the House budget process?
No, and the reason for that is that we did not have finalized numbers at that point. I could have presented what we knew in the House and then changed it again in the Senate. What I said to the House is that we preferred to wait until we had the best information and present it in the Senate. And Henry could provide a little more context on why we didn't have all the information yet.
I think
follow up?
Yeah, and this is, again, I admit to not being totally conversant with how things are done in this very complex world of Medicaid services. Are any of these items that are under consideration, 1 through 3, capable of being dealt with through the fiscal committee? And again, I fully admit I'm not very conversant in the Medicaid processes.
Sure, to Senator Rosenwald's earlier comment, it could be if we are transferring the funds from other places. I cannot come to fiscal committee and request general funds unless there's statutory authority for me to do that.
I didn't hear that.
What you said is that you can't come to fiscal and ask
For general
General
funds.
funds.
Right. You could bring in the additional federal match through fiscal, right? But you can't appropriate the general funds.
Correct, and I can't earn the federal fund without the general fund.
Right.
Any further questions? Motion before us is items 1 through 3.
Can we ask for a recess?
Okay.
I'll
The
leave.
committee will be in recess.
Okay, so you guys can all stay put. I'll go hang out with Deb in the back if she doesn't get to stay. Just will someone knock on the door for me? Thank you.
Okay, committee will be back in order. And Chair recognizes Senator Gaida.
Thank you, Mr. Chairman. At this point, because of pending information that's forthcoming, I will remove my second for the motion that's currently on the floor.
Okay. So is there, still is a motion by Senator Rosenwald. Is there anyone who wishes to second her motion on items 1, 2, and 3? Seeing none. Motion fails for lack of a second. Is there anything else on the list? Senator Rosenwald.
Thank you. I would like to move items 4 and 5 and 6.
Senator Rosenwald moves items 4, 5, and 6,
And 7.
and 7. Is there a second to that motion? Motion fails for lack of a second. Is there anything else committee wishes to address? Senator Rosenwald.
Thank you. I'd like to move item 8, which is a House Bill 2 amendment from Senator Bradley and me on Medicaid dental.
I'll second it.
Senator Rosenwald moves item 8. That's seconded by Senator Gaida. Discussion?
I think we've said it before, so I don't know that we need to say it here.
Okay. Seeing no discussion, ready for the vote. We're on item 8, which incorporates the language from Senate Bill 150, establishing an adult dental benefit and make an appropriation in 2023 only. Senator Morse,
Yes.
Senator Hennessy, Senator Reagan, Senator Gaida,
Yes.
Senator Rosenwald,
Yes.
and the chair votes yes.
Thank
Item
you.
number 8 carries. Anything further? Senator Gaida?
Question of the chair. We will still be able to visit any of the items that have not been moved in subsequent sessions of this committee. Is that correct?
Yes.
Thank you.
Senator Rosenwald.
Thank you. I'd like to move items 9 through 14 and speak about them separately.
Sorry, I didn't hear that.
Well, I'd like to speak about them separately if they're seconded.
I didn't hear the items.
I'm
that we're
sorry,
moving.
9 through 14.
Okay, so Senator Rosenwald is moving items 9 through 14, but would like to speak to them separately. Is there a second to that motion?
I'll second for purposes of discussion.
Okay, Senator Gaida moves
you.
for discussion purposes. Senator Rosenwald?
Thank you. So some of these will save us money, like number 9, number 10. 12, I think, is cost neutral, but we do have hospitals in the state that have residency programs. And so I think it would be better to suspend the IMG and the indirect and the direct graduate medical education rather than repeal them. And on number 14, the department was required to do rulemaking, and I believe they haven't really done what they're required to do. So this is an amendment to require emergency rulemaking for home visiting programs.
Okay,
And so 10, I should say that the cost was $8 or $9 million. I think if we don't suspend it, there is no appropriation for it. There's no funding. So I believe number 10 makes sense, and we should suspend the in and out medical assistance for the biennium.
Okay,
Thank you.
further discussion. Senator Hennessy.
Thank you. Do you know, was this actually ever enacted? I'm looking at the bill from 2020, and it doesn't look like it even went to one finance committee. What was the effective date for this?
I believe it's House Bill 1639. The in and out.
It has about a dozen different parts to it.
Right, I think it was.
Just to follow up, if we're going
Follow
to
up.
suspend it, did we ever enact it? What did the department ever implement this in and out program?
It wasn't to go into effect right away. So no, but it's now in effect, I believe.
Sorry, if I could, that had an effective date of June 30th, 2021, so it hasn't
Yeah.
yet gone into effect.
Senator Morse.
Yeah, I'm concerned about doing any of this until we clean up what we left behind here. But on item number 11, which is in with this big vote we're doing, I believe there's an amendment being drafted to that complements this. This is probably $2 million, and
I think it's about 2 million.
and I think there's an amendment being drafted at 8 million total. 2 of it would come from this suspension. So, I mean,
I'm willing to withdraw my motion if we're going to come back to this division.
well, we have to come back to this
Yeah.
division.
Well, I know, but I mean,
here's-
if we can
here's the bigger
revisit.
problem. The bigger problem is, I believe what happened is the House was given a date and all the kids, they were funded up to a certain point. And then the Senate's picking up probably another 3 months worth of funding here. I thought when I heard this, that wasn't necessary. So I think we need to get concrete details on, does this need to happen? Doesn't need to happen. So, because,
I mean, if we're going to come back and talk about all of this after, I'm willing
well, I
to,
don't think we can walk away from it. So it's-
I'm willing to withdraw my motion for today.
All right. Thank you.
Okay.
All right, we will revisit that. Again, let's go on to. I think that covered everything on that division. We want to go on to the Division of Children, Youth, and Families. Senator Morse.
Yeah, on the Sununu Center, I don't think there's anyone in this room that doesn't think we need to solve 23. What I asked the governor's office and the department 2 weeks ago was to come up with a plan. Senator Rosenwald delivered a plan yesterday. I think they told me it was going to take almost a month to get the plan, but I'm hoping by the beginning of next week, we have a plan for the Sununu Center and we can talk about it as a Senate, how we want to handle it. But basically, if we close, these children, they don't go away. And I think the House appropriated $2 million for the year 23, take care of the problem. And then we're left with several other problems. One, do we not build another building at $11 million? The cheapest I've heard to operate that building is $7 million. You know, if we move out of the Sununu Center, do we owe the federal government money? Are we going to sell the property? There's a whole bunch of what ifs here that left. This item number 1 needs to be, it's a whole package that has to be written and accepted by us. I understand the House wanting to close it, the advocates wanted to close it, I get all that, but you can't just close it and not have a plan, and there's no plan yet.
Senator Rosenwald.
Thank you. I agree with Senator Morse. The House didn't really fully do it. They started it. And with your permission, Mr. Chairman, I would like to be able to give the documents that I gave to Senator Morse yesterday and Senator Bradley out to the rest of you to look at as a platform for discussion. And do I have that?
I think they handed out already.
Already.
We have.
Great. And you know, in fairness, I'd say that Senator Bradley already has reactions to it. Things that he thinks it goes too far on, or it's too aggressive on, or whatever. So I think it is going to take some discussion, a lot of discussion among all of us, because even the department wants to close it now. So there's general agreement that we should close it. We have to figure out what services these kids will do best with, because they're going to get out when they're 18, most of them.
So the amendment you're talking about is 1543.
No, it's not actually an amendment. It's two different
Oh, the what, the,
proposals.
okay, got it.
Yeah, one is more narrative and the other one is more section. I didn't have it drafted because I figured it should have discussion. And if Senator Morse and the governor are coming up with a plan too, we should have as much to work from as we could. But I would like to move item number 2.
And is the item number 2 one of the on the hold in the Senate calendar? Is that item number 2 that's on? Oh, no, not item. Yes, item number 2 here. Is that part of the tabled stuff in the House, in the Senate?
I don't think so. This is a agency request to restore 22 child protection workers that were defunded by the House or the governor.
They were unfunded in the governor's
Okay.
budget and also unfunded in the House. And I don't believe there's a Senate bill that would fund these.
And I'm not aware of anything that's on the table.
So Senator Rosenwald is moving item number 2. Is there a second? Second by Senator Reagan. Senator Hennessy.
Thank you. On page 1081 of our compare report, Mr. Revolt, could you tell us what was added by the House in class 59 and class 60?
Sure. Let me just pull up the compare report. Sorry, could you give me that reference again?
Page 1081, class 59 and 60.
Okay, thank you. Yep. Just 1 second while I pull that up.
While you're looking, I also want to get an understanding why it looks like the source of funds percentage has changed a bit over 2021 and what's budgeted for 22 and for 23.
Okay, I'm not sure about that part of the question. The department may be better able to answer that, but based on the dollars here in account 2957, I believe this was one of the budget adjustments that was asked of the House by the department. So I'd have to go back and look at the detail on that to see what exactly it was for.
Maybe the department can tell us.
I can. So class 59 and 60 additions in the House were for two positions that are 100% federally funded. So if you go down to the funding, the total funds, the difference between the governor and the House, it's 100% federal adjustment there. With regard to the funding percentages being different than 20 and 21, I don't know that off the top of my head, so I will get that information back to you. And it's, the two federally funded positions are related to a grant. I'm sorry. I should have mentioned that as well.
Okay, Karen, you said that the House funded two positions, correctly?
Correct. Two positions that are specifically related to a grant. So those positions will work only on that grant.
Okay. Should I expect that the difference in the House and the governor is going to be the same as the federal funds difference between the House and the governor?
Yes. Yes, you can see that in the difference column.
Okay, but I see that it looks like that the federal fund difference between, well, okay, well, I guess there's probably other ones in there. Okay, never mind. Any further questions? So we have a motion before us to adopt item number 2, which establishes but unfunds. Which I guess the House so Fund 22 established but unfunded the workers. So this would reinstate the money for the individuals. 22. Senator Hennessy.
Thank you. It looks like there was a huge lapse in 2020, and I'm wondering what the lapse in 2021 is and how many of these positions are currently vacant.
So I don't know the lapse numbers. I can get that for you on what we're estimating for fiscal year 21 right now. At the time of the governor's budget, there were about 40 vacant CPSWs. I don't know what Joe, do you have the current?
Yeah, as of the data the other day, it's 41 vacant frontline CPSW positions that we're working incredibly hard to fill, but still working it.
Follow up, Mr. Ribson, can you tell me of the 41, those must be all funded in 21, but are 19 of them not funded in 22?
That would make sense. I don't remember the exact number, but that would be about right, because the way that the last budget, there was a Senate bill specific on this, worked. A portion of the new positions came in one fiscal year and the balance came in the second fiscal year.
Follow up. And are these positions normally have a high vacancy rate?
So we've struggled since long before I got here around the ability to fill child protection worker positions. When the last budget went forward, we did some calculations to figure out exactly how many staff we would need to hit our target of appropriate caseloads per staff. That would be 12 assessments per assessment worker, 15 per family service worker. And we've been moving steadily towards getting to that point. Our caseloads are much more reasonable now than they were a couple of years ago, but we still have more room to go. Turnover remains a challenge. It's better than it was a couple of years ago, but still remains a challenge. We also had the benefit of receiving a number of supervisory positions in the last biennium, which allowed us to build out an adequate supervisory staff for our frontline caseworkers. But it had the unfortunate effect of having a lot of our frontline staff be promoted, which then exacerbated the problem with frontline child protection workers. All that's to say is yes, we've had a issue with vacancy over time. We're working very hard to try to remedy it, but it's an ongoing process.
Further discussion, Senator Gaida.
Thank you, Mr. Chairman. Joe, was my assumption would be that DCYF line workers, frontline workers were essential. We're not hiring frozen, if you will.
That's correct.
Okay.
Yeah, and we've seen, we actually had a really, a boost in hiring during the period of the freeze, actually, because we were really the only state employer open. And we've actually seen the last few months, the number of applicants for child protection workers drop significantly. So we've had last few months have been hard. We feel like we've been treading some water.
Thank you.
Further questions? Senator Rosenwald?
Thank you. When I look at the department's dashboard every month or when it comes out, am I correct that I see basically a higher percentage of filled child protection staff? Maybe the number of vacancies isn't zero, but because we gave the department significantly more resources to solve the problem you identified, that the percent of vacancies is much lower, and we're aiming towards that target caseload.
Yeah, I think that's accurate. And if you look, I have a dashboard that I look at, right? And I only have the last few months of data here, but for example, we have 161 assessment CPSWs. They're the ones that do the investigations. In November, 19% of those positions were vacant. Today, 14% are vacant. So it is moving in the right direction, but it's been a slow row, and turnover exacerbates that problem as we hire.
Thank you.
Any further questions or discussions? Motion before us is the adoption of number 2. Ready for the vote? Senator Morse,
No.
Senator Hennessy, Senator Reagan, Senator Gaida,
No.
Senator Rosenwald,
Yes.
and chair votes no. Motion fails 2-4. Anything else to be taken up under children, youth, and families? Most of the other stuff has to do with Sununu. You'll have a chance to read through the things that we have. With that, that completes our agenda for today. We will meet again tomorrow morning at 9 o'clock to continue working on Health and Human Services. In the meantime, I would encourage you to read through the document that Senator Rosenwald put out and give some thought to ideas as to what we might be able to do about the Sununu Center to take care of the issue and yet keep it as affordable as possible. So with that, I will take a motion to adjourn.
So moved.
Moved by Senator Gaida.
Second.
Second. Senator Rosenwald seconds. Senator Morse,
Yes.
Senator Hennessy, Senator Reagan, Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
And chair votes yes, and we will be adjourned. Thank you for joining us today.